At the Touro University, California Master of Public Health program, we prepare students to tackle today's pressing health challenges with a mixture of technical skills, health sciences theory, and compassion. Touro's MPH program offers 3 tracks: Community Action for Health, Global Health, and Criminal Justice and Health. Here's what it looks like to be a student in our MPH program.
I was working as an EMT during the pandemic, bringing the same patients back week after week with their last hospital admissions bracelets still on their wrist, and realized we had more of a systemic issue here than a healthcare issue. I knew I wanted to make a bigger impact.
Touro's Health and Criminal Justice track stood out to me from day one. You don't just learn policy, you apply it directly in the community.
I chose the global health concentration because I wanted to understand how culture and limited resources shape healthcare. As part of the program, I spent over 2 months in rural Uganda supporting a research project on contraceptive use and cervical cancer screenings in partnership with Dr. Sahai Burrows.
I engaged directly with community members, conducted partner interviews, and led reports on how the systems in place could improve to better serve the Vallejo community. Those hands-on experiences shaped my passion and helped me land a spot in the California Epidemiologic Investigation Service Fellowship. Touro made that possible.
Seeing mothers travel to the clinic barefoot, walking 5, maybe 10 miles, it made me think about access to healthcare. We were collecting rural data in remote villages, no frills, just people, paper, and persistence. It wasn't easy, but it taught me how to be resourceful and culturally competent. Today, I work in a small community clinic where I draw on those same lessons: understanding patient needs, building trust, and delivering care with compassion, even when resources are stretched.
I interned in Washington, D.C., where I analyzed federal healthcare policy and even sat in on congressional meetings. For my capstone, I worked with low-income seniors in Solano County to improve access to advanced directives, helping ensure their end-of-life care reflects their wishes. Now I'm back at Touro and in medical school, and everything I've learned in the MPH program continues to shape the kind of doctor I want to become. I'm just truly grateful for what the MPH program here at Touro has given me. I came into it thinking I knew exactly what I would get out of it, but it taught me so much from this and learned how I can make an impact with my MPH degree that I never even imagined I could have made before.
MPH class sizes were really small and intimate. You kind of lean on each other in a sense because you're with each other a lot during the week, so you get to know each other personally.
I think having a smaller cohort allowed for greater connection, ease of access for reaching out to professors where they really wanted to help you. And the work that we did allows you to branch out and work one-on-one with them.
And there wasn't a professor I had that I didn't have a one-on-one connection with or a phone number that I could dial up even 3 years later.
It wasn't always an easy program, but I found it incredibly rewarding.
You'll leave Touro with more than just a degree. You'll leave with a sense of purpose and a real direction for how to make a difference.
Whether your passion is local or global, clinical, or policy-focused, our MPH program gives you the tools to lead with impact. This is public health in action, and it starts here.